Hello, I'm Todd Didier, Communications Director for the Primary Care Collaborative. Every month, the PCC recognizes outstanding leaders from across the nation who are champions for primary care. Today, we're thrilled to recognize Susan Edgman Levitan, a former PCC board member and executive director of the John D. Stokel Center for Primary Care Innovation and Massachusetts General Hospital. Susan, thank you so much for joining us today. We're thrilled to have you here.
Thank you for inviting me. I'm thrilled to be here.
Fantastic. Well, we'll go ahead, jump right into it. You, in your career, you have been a longtime champion of primary care, a longtime advocate for it. Could you tell me a little bit about how you became a primary care champion, why you're so passionate about strengthening primary care in general, and really what drives you as a champion of whole person primary care?
So I feel incredibly lucky and fortunate to have had a long career in primary care. And I think that the work that I've been involved in primary care actually led me to all of the other things that I deeply care about, like patient and family centered care, patient safety, because they are all intertwined and they all are at the foundation of what makes a really strong healthcare system that delivers incredibly important outcomes to the public and the people we take care of. And I think that my good friend Asaf Batan likes to share and emphasize that unlike many other areas in medicine, where there are risks and benefits, there are pros and cons to different treatment options or diagnostic options, there are no downside elements of primary care. There is no evidence that counters the incredible importance of primary care to achieving overall health for a community, a state, our country. And that has been a blessing to be part of that. When I was in training to be a PA in family medicine at Duke, primary care was the specialty to go in. It was where all the cool kids were because everyone was so passionate about being able to work in communities, help kids, help adults, help everybody receive the best care possible. And it was gratifying to me when I began my career at Mass General. I was surprised and thrilled that two of the senior leaders at Mass General, both primary care doctors, had also been in training at Duke at the same time that I'd been there as a PA. So we were definitely imprinted early in our careers. And in North Carolina, which had an unbelievably strong primary care foundation, about why this is so important.
Kind of diving into it, we've talked about what really drove you into becoming a champion for whole person primary care. What does that look like to you? How would you define whole person? What does comprehensive whole person primary care look like to you?
Whole person primary care, comprehensive care, what it looks like to me is that um, we build a clinical team in practice that can partner with our patients over the course of a lifetime if they're lucky, and if not, at least for many, many years, so that you know a person when they're healthy, you know them when they may develop chronic conditions, and most importantly, you know when they at some point develop a serious illness where it's critical to know what would matter most to them if they can't speak for themselves, what's important to their families. And I also know that my career in and passion for measuring and improving the patient's experience of care came from my early days in primary care. I was fortunate enough to work in a FQHC in very rural North Carolina. We had one little brick building that had been a solo physician's office, and then it had attached to it house trailers. And that's actually where we saw patients. And the reason I was fortunate is that the only rooms in those house trailers that were soundproofed were the behavioral health rooms. So you could hear all the conversations, sometimes, not always, going on that the other clinicians were having with their patients. And one day, the head nurse practitioner who had founded this practice pulled me aside. I'd been there maybe 6 months and was a new PA graduate. And she said, Susan, you're doing so great. You're doing everything by the book, but you're really missing the boat on certain things. And I was horrified. And I said, well, you have to tell me more. And she said, I don't think you really understand the backgrounds of a lot of the people you're taking care of, and they don't know you well enough yet to be able to be completely honest with you. So you're telling all these young women with little babies with bronchiolitis to take their babies into the shower so that they can, benefit from the steam. They don't have running water, and they're not telling you this. And I was horrified. And I realized, oh my goodness, I really need to understand my patients better, where they live, what they eat, what is easy for them, what is not, which is really social drivers of health. And our practice started supporting us doing home visits half a day a week every week. And boy, did that teach me what whole person care is and why it's so important and why understanding the people you're taking care of, the communities they live in, their family environment. And I think the most important thing I learned is figure out quickly who are the most important lay people in this community that everyone listens to about healthcare issues. They are the people you need to be talking to. They are the people you need to be educating. And that's how you build a strong primary care base.
Thinking about that and thinking about that vision for primary care, uh, there's a lot in the American healthcare system that's not working right now. And especially a lot that's making it harder for us to deliver the kind of whole person primary care that we've been talking about. If you could emphasize one major message to policymakers, thought leaders, other experts in healthcare, what would it be and why?
We need to fund primary care at the level that allows our clinicians, our other staff, and our patients to actually deliver and get the care that they deserve and that they need. Primary care gets 5% if you're lucky, depending on what state you live in, of the healthcare dollar. That is absurd. And we keep expecting that if we give primary care just a titch more money, we'll see all these great improved outcomes. And it's not going to happen like that. You need a longer time horizon for these funding changes. You need more dramatic funding changes. And I think most importantly, and I said this recently at a meeting, I helped co-lead a focus on primary care for an international innovation collaborative called the Future of Health. And we basically said primary care is in desperate need of a marketing director. For whatever reason, no matter how much we share the impact and the importance of primary care for the health of our country, it doesn't seem to be heard by the people making these funding decisions. And everyone is affected by primary care shortages. I don't care how much money you have, how much influence you have, what your standing is in the community. Every single person I know is struggling to get a good primary care clinician. And that is not okay. And there is no reason that that should be the situation we're in. We need to support the workforce. We need to build good, high functioning primary care teams, which means everyone on the team has a role and an important role in their interactions with our patients and their families, and we need to give primary care the respect and the value that it deserves.
As someone who's a major leader in this space who has really dedicated their career to making primary care better, I'm curious, what advice would you give to up and coming leaders who really want to improve primary care and the way it serves patients and communities?
Our clinicians are probably the best spokespeople to advocate what we need for primary care to enhance support for primary care, although they probably have more on their plates than any other clinicians out there, given the complexity and the breadth of the conditions and the patients they care for. But they do, I think it is important to understand why primary care is struggling, because I think many clinicians actually do not know how little funding primary care gets in the overall funding universe. And so I think being educated and knowledgeable so you can be a good advocate for the care you deliver and for the patients you serve is important. And I think that that is something that practices can support. If your practice is part of a system, that you need to advocate with your system to support that. And I think hand in hand with that, we really need to help our clinicians focus on how to improve the actual workflows and the delivery of care in their practices. Because more funding is necessary, and that will certainly help that. But there's no amount of money you can pay someone to work in a really dysfunctional practice or setting and be happy. And so we have to work on these things together. The other thing we know that I think is important to acknowledge and promote is that when clinicians and staff feel supported in their work, and feel able to make the changes in their workflows and how they're delivering care that they think will help them, we also know that the patient experience gets much better. And I think one of the mantras that I've always said is that if you're not the person delivering direct care, your job is to support the person who is and make sure that they have all the training, all the resources, and everything they can do. And I think sometimes those of us in primary care, because we've worked so hard and we feel so burdened, that we actually lose our ability to fix the problems that are staring us right in the face that we actually do have control over. So get rid of the learned helplessness.
So, one last question for you here. We've talked a lot about some very concrete things. We've talked about where the state of things are, but I always like to end with just a sense of optimism and a little bit of fun here. So, if you could wave a magic wand and change one thing about the American healthcare system overnight, what would it be?
I need a really big wand. Um, I'm thinking of like wind turbines um, in my imagination. Um, oh, goodness. I think that we would have, if I could wave a magic wand, we would have medical schools, nursing, PA, and NP schools that gave free tuition to people that agreed to go into primary care for a certain number of years, because we really need to increase the primary care workforce. And with that, we would increase their interprofessional educational opportunities so they would know how to work together as a team. I think I've already made the point about additional funding. And my final wish, and this is where the really big one comes in, is that we would provide universal health care coverage to everyone. And then our clinicians would not be overwhelmed by the demand to focus on how they code their visits, maximizing revenue in a starved system. Um, it's crazy. And so we would address many of the things that are driving people, and not just in primary care, but driving all of our physicians and other clinicians out of delivering care. And we'd be much better off.
Thank you very much, Susan. I very much appreciate you joining me for this interview. And most importantly, I know I speak for the primary care community at large when I say thank you for your phenomenal leadership and work over the years. And you truly are a primary care champion, and it has been a pleasure to work with you. And we are sad that you are no longer on PCC's board of directors, but we are thrilled that you remain a vibrant primary care champion.
Well, I think I will go to my grave as a primary care champion. And again, I think it's been such an incredible career choice because the other thing that I love about it is that only the best and nicest people go into primary care. And so it is definitely the tribe I want to be part of.
Here, here. Thank you very much.
Thank you, Todd.